It's a cold, wet day in Ulaanbaatar suburbs, but these doctors have patients to visit, come rain or shine. 2 years ago, 61-year-old CHULUUNTSETSEG was diagnosed with late-stage urethral cancer. She was prescribed an oral dose of an opiate-based painkiller, tramadol, but it wasn't enough to ease the pain.
Since I'm a really stubborn person and act impulsively, when the pain became unbearable, I injected myself with tramadol. After that, I was put on morphine.
Today, with a daily dose of morphine pills and visiting doctors, CHULUUNTSETSEG says she can look forward to the next day. This is an example of palliative care in action. It focuses on relieving pain and helping improve the quality of life for patients with life-threatening diseases. In 2006, Mongolia became one of the few developing countries in the world to include such care in its national health law. Much of it is thanks to the work of one woman who spent years fighting for the terminally ill.
It is human right to receive treatment even in incurable stage of disease, to be not suffer from pain, and it's human right to receive psychological support.
Today, patients can access opioid-based painkillers under medical supervision, all covered by national health insurance and strictly monitored under international drug laws. Every district hospital also has a palliative care ward.
It's been a little over a decade since Mongolia became one of the few developing countries in the world where state-sponsored care for terminally ill patients became a part of the National Health Service, a huge achievement. But advocates say safeguarding this right is a never-ending task.
Palliative care was twice scrapped from revisions of the national health law by newly elected governments and reinstated only after advocates stepped in. Mongolia has one of the world's highest cancer mortality rates. More than 80% of cancers are detected late.
To reduce the burden of cancer, we are trying to detect cancer in the early stage and prevent those cancers.
He says palliative care is now firmly rooted in Mongolia's healthcare laws. But services are underfunded, and patients who can't travel to public hospitals depend on charity organizations and doctors working overtime for home visits.
Besides the patient, the family, relatives, they all share the pain. I'm happy to give them some comfort.
It's this next generation of young doctors that Dr. Odontuya hopes will carry on the motto of Mongolia's Palliative Care Society. Life begins with love and should end with love. Pearly, Jacob, Al Jazeera, Ulaanbaatar, Mongolia.